I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I am here with my fellow commissioners, Vice Chair Ken Lawrence and Commissioner Joe Gale. I'm also here with Dr. Alvin Wong, Regional EMS Director, and Dr. Brenda Weiss, Director Administrator of our Office of Public Health, and Sarah. We're so grateful for. So this is day one of week 2 of the presence of COVID-19 here in Montgomery County. I'm very happy to say that we have made it through that first week and have taken extraordinary measures in a very short amount of time since we were first notified of 2 presumptive positive cases here in Montgomery County last Saturday. This remains a rapidly evolving situation, and I will do my best to answer your questions as fully as I can, but I may not have all the information that I need to answer them completely. So as has become our practice, I am updating you on any new information that we have since our last press conference the day before. So since Friday, March 13th, we've had 3 new presumptive positive cases of COVID-19 in Montgomery County, which brings our total to 20. First, we have an adult female, 18 years old, who resides in Lower Providence Township, whose symptoms do not require hospitalization and is currently at home being monitored. This individual has direct contact with a previously identified presumptive positive individual in Montgomery County, and contact tracing is underway. Second is an adult female, 34 years old, who resides in Perkiomen Township, whose symptoms do not require hospitalization and is currently at home being monitored. This individual resides with the previously identified presumptive positive individual in Montgomery County. Contact tracing is underway. Third is an adult male, 38, who resides in Douglas Township, whose symptoms do not require hospitalization and is currently at home being monitored. This individual had direct contact with a previously identified presumptive positive individual in Montgomery County, and contact tracing is underway. Couple of updates. My first is for parents. I'm a parent, several of us up here are parents, and we've got many questions about what parents can do with particularly their young children now that school is out. So we have some recommendations for parents. The first of which, do not be embarrassed to ask the questions that I'm going to suggest that you ask before either a child comes to your house or you send your child for a play date. First of all, the first question is anyone in either house sick? So if 2 children are coming together, first question is anyone in either house sick? No child should walk into another child's house without having their temperature taken. And if that child has a fever greater than 100.4, then play date's off. You really want to keep the numbers low. 2 kids, 3 kids. The goal here is to keep a very tight circle of people who you know well, you know where they've been, you know if everybody's healthy. This is extremely important. Everyone should wash their hands or use hand sanitizer upon entering a home and upon leaving a home. All toys should be sanitized regularly. If you could play outdoors rather than indoors, that is preferable. And again, I just want to mention that don't be embarrassed to ask these questions. This is not our new forever. These are just common sense steps that we need to take right now to help limit the spread of coronavirus in our Montgomery County community. And I also do want to remind everybody that our trail systems are open, so you're welcome to get outside and enjoy our wonderful system here in the county with your family. Now, a couple of updates for our businesses. We had a number of questions yesterday afternoon about what the governor's announcement about businesses meant. We got the following clarification from the governor's office late yesterday. I'm going to read, and this is a quote. Critical infrastructure will stay open. This includes all healthcare facilities such as pharmacies, urgent care, primary care, outpatient services, long-term care facilities, hospitals, gas stations, and grocery stores. The governor went on to say, and I quote, before utilizing his full authority to compel businesses to close for the purpose of protecting the public's health, it is the governor's hope that they will heed his strong recommendation to mitigate the spread of this disease. My comment to businesses that remain open, please take common sense precautions to put social distancing procedures into place. If the size of your business does not allow for social distancing procedures to be put into place, please consider closing for the sake of our community. We have information posted on our hub website, moncopa.org/COVID-19, where we attempt to answer many of the frequently asked questions posed by businesses. This part is located under a banner that says resources that is just under the county map, and we're constantly updating that, so you should feel free to check back regularly. There have been a number of questions about testing, and we're going to do our best to answer some of them. But I do want the public to understand that at this moment in time, testing remains fairly limited here in Montgomery County and in our region. Doctors do have some options to refer tests to outside commercial labs. These labs currently have a 3 to 4 day turnaround. We are working with all levels of government, including federal agencies, to expand testing. As soon as we have some movement on that, I will let you know. I also want to clarify that the Montgomery County Office of Public Health, while a resource for information, does not conduct testing. So you are welcome to call our Office of Public Health with your questions. We will also do our best to connect you to a facility that might be able to test you, but we don't offer that service ourselves. People can call our Office of Public Health after hours at 610-631-3000 and during the week at 610-278-5117. Now let me talk a little bit more about testing and who really needs to be tested. If you have mild symptoms, a dry cough and a fever above 100.4, you should call your healthcare provider, stay home, and self-isolate. Because the treatment for COVID-19 is supportive, the results of testing, as long as you're staying isolated, will not change what you should do. And in this moment where we just don't have a lot of tests available, if you've got a dry cough and you've got a fever, just sit tight, self-isolate, and hopefully fairly soon we'll have access to more testing. If you have more serious symptoms that include shortness of breath, you should definitely call your healthcare provider and follow their instructions. And obviously if you're experiencing life-threatening symptoms, you should call 911. So in all cases, you should absolutely reach out to your healthcare provider, or you can call our Office of Public Health with questions. But if you have mild symptoms, it's not going to change anything that it will happen in terms of treatment. There is no specific treatment for this disease. And if you stay home and isolate yourself, you're doing everything that needs to be done in that moment. One of the most frequent questions that we get is, what should someone who has no symptoms do that had a contact with someone else who was known to be exposed to a presumptive positive patient? This is probably the #1 question that we get. So we have made an attempt with this graphic to try to walk people through it. So Brenda, I'm actually going to ask you to stand. Yeah, that would be great. So hopefully you can see this fairly well. Mark, do you want to come around? Maybe?
I'll post this also,
Okay,
yeah.
Perfect. So those that are on Facebook, we'll post this graphic separately. So up at the top is a presumed positive case, who we're going to call person A. Just beneath that person is person B. Person B learns that they've had direct contact with a known positive case. Person B would be told that by a call from someone in our health department who is doing contact tracing to let them know that person A, who could be a friend or coworker, is now a presumptive positive for the coronavirus. Okay, so when person B gets that phone call, they're going to be asked to go into quarantine, to self-quarantine for 14 days. Now, The next question on this chart is, does person B have symptoms? If the answer to that question is no, then you're going to move to the left side of this chart. If person B does not have symptoms, then they will be watched for 14 days. If they develop no symptoms, they'll be removed from the list and they can go on about their daily business. Any contacts to person B under this scenario are considered not exposed. All right, we have that. Does that make sense to everybody? Okay. Going down the other side of this graph, let's say that person B, who's in quarantine because they had direct contact with a presumptive positive individual, develops symptoms. Right? So now person B has a fever or a cough. They will be tested. If person B did not test positive, then they're going to finish their 14-day quarantine and go on about life as normal, and their contacts are not considered exposed, right? Maybe they just had the flu. However, person B tests positive. Now they move into isolation for 14 days, and the contacts of person B all have to go into quarantine. So let me define those words. Isolation means that we have diagnosed you with COVID-19, and you're now in isolation. Quarantine means you've been exposed, but have not yet developed or been diagnosed with COVID-19. Okay? So this is our attempt to explain that the contacts of someone who's been deemed a presumptive positive do not need to be tested, they're not considered exposed, and they do not need to isolate. That is probably the vast majority of phone calls that we're getting, and those are some of the people most concerned about being tested. Those individuals do not need to be tested. All right, and we'll post this on our Facebook page for Montgomery County. I will share it we'll all share it on our pages so that you can kind of take a look at it and think it through. And if you have additional questions, just let us know. Additionally, on our hub site, which is listed up here, today we have posted the most recent guidance on testing from the Pennsylvania Department of Health. So that's where you can read what I just tried to show you in a graphic way. You can go through and read the actual words. So that might be helpful as well. All right, with that, I'm going to turn over to Commissioner Ken Lawrence to describe some of the other work that the county's doing.
Okay, thank you. I want to talk about some of our most vulnerable populations right now. We're committed here in Montgomery County to ensure that we continue service to them as well, as they may need it even more. We've established continuity of operations for our Community Connections program by establishing remote teams that will keep service operational throughout this emergency. We're working with Montco Anti-Hunger Network to support children, families, and seniors meet their nutritional needs. Those who are looking for resources, pantry locations, or those who want to donate or volunteer can go to www.montcoantihunger.org. We've been working with our county collaborative network of nonprofits to identify needs in the community, develop plans to support our nonprofits, and keep services to our most vulnerable residents operational. And here is one need that we have seen, the Montco SAC, SAAC. With senior centers closed over the next 2 weeks in Montco, there's a huge demand for Meals on Wheels drivers. So if there's someone who wants to help out, you can call 610-275-1960, or you can email slee@montcosac.com. We have 350 homebound seniors who depend on the Meals on Wheels program for their nutritional needs, and they need volunteers to help deliver those meals. So if anyone can help out with that, and that will be posted on our website as well. For our schools, on behalf of our 22 school districts, we reached out to the Pennsylvania Department of Education, who has given us written confirmation that appropriate district staff are permitted to access food preparation areas and prepare meals for distributions to students. We would urge any family that has school-aged children who has nutritional needs to contact their school district. We are aware of at least 2 school districts that are preparing grab-and-go programs that will be up and running next week, but you should contact your local school district for that. I want to share some of our businesses are doing to help people out during this emergency. PICO, effective Friday the 13th, 2020, PICO is suspending service disconnections and waiving new late payment charges through at least May 2020. PICO will continue to remind customers of existing bill assistance programs and energy assistance programs to support them through temporary or extended financial hardship. Customers who are challenged to pay their bills or who have received shut-off notices should call 1-800-494-4000 or visit www.pico.com/help. Aqua is also placing a moratorium on terminations. And Comcast is offering new low-income internet essential customers 2 months of free internet and raising the speed of the program service. They are also providing Xfinity Wi-Fi free for everyone for 60 days with unlimited data usage, no disconnects or late fees. And I would also like to acknowledge one of our corporate leaders, Preet, who owns the Plymouth Meeting and the Willow Grove malls, and they have closed those malls. And now I'd like to turn it over to Commissioner Gale, who will share some of our public safety initiatives.
Good afternoon, everyone. During times like this, communication with the public is very important, and I wanted to provide an update on what our Department of Public Safety, along with the Office of Public Health, is doing in Montgomery County. As many of you know, we were notified of the first 2 presumptive positive cases 1 week ago on the evening of Saturday, March 7th. The Montgomery County Emergency Operations Center has been activated since Sunday, March 8th. We're now on the 7th day of operations. The Department of Public Safety and the Office of Public Health have developed contingency plans to ensure staffing if any employees become exposed or infected and cannot return to work. Throughout the week, we've made significant efforts to keep both the public as well as our public, private, and non-profit partners informed. We are currently operating multiple pathways for the public to stay informed, including a hub, which you heard about, the websites included on my right on the screen, as well as dedicated public inquiry phone lines and email lines. We have already received nearly 500 calls from concerned residents. Staff are constantly taking feedback from inquiries received to adapt future public messaging. We are also pushing out regular messaging on our social media platforms. This includes live streaming of our daily press conferences such as this on Facebook and on Twitter. You can follow the Twitter handle at MC Public Safety. We've hosted discipline-specific conference calls for our first responders, municipal managers, school districts, and houses of worship to keep them informed of current situations and to provide guidance for operational decision-making. Our county staff is working to adapt this rapidly evolving situation as well as we plan for future contingencies. Our County Emergency Communication Center continues to screen 911 calls for COVID-19 symptoms, and our staff from the Office of Public Health, once notified of a presumptive positive case, work around the clock to identify anyone this person may have come in contact with and make appropriate notifications. And as many of you are aware, this process is known as contact tracing. We are continuously working to support our first responders, including police, fire, and EMS. Our staff have been fulfilling numerous requests for unmet needs for PPE from first responder agencies. We're making sure all those requests are addressed. We developed several guidance documents consistent with the Pennsylvania Department of Health and the CDC recommendations as well for first responders to ensure that they have the knowledge that they need to respond to this evolving situation. In order to ensure coverage for first responder agencies affected by one or more exposed or presumed positive employees, we have developed mutual aid staffing plans in consultation with countywide responder associations. As I said earlier, communication is key. I'm very proud of the hard work all our staff and personnel has done in the Department of Public Safety. Our Office of Public Health. They're working around the clock. We have to come to a sense of normalcy in Montgomery County, and they're working hard to do so and addressing all the needs. And during times like this, we know it can be stressful for families with students out of school. They see some business closures. It changes all their daily routines. But to bring that normalcy, we have very skilled staff that are working around the clock to make that a reality. And I would ask the community, Montgomery County as a whole, to please keep our emergency responders, our public safety personnel, our Office of Public Health personnel in your prayers. I know President Trump officially declared Sunday, March 15th as a National Day of Prayer, and I ask that we all join in support of that community of public safety and pray for them and their families during this time as they work around the clock. So we will keep you up to date as much as possible. Again, please refer to these websites and phone lines. We have the staff to answer any questions or concerns the public may have during this time. Thank you. I'll turn it back to Commissioner Arkush.
Thank you very much. So just to close, we really know that this is tough for folks. We know this is hard for families, for businesses. It's really upended just about everybody's life. And I just want to thank everyone out there who's been listening and following along and staying calm and following the advice that's being given as we all learn together in some ways about this brand new disease. I cannot thank our staff enough here in the county. They have been absolutely extraordinary in the face of a very rapidly and continuing to evolve emergency. And I just want to share one little story with you. You know, I've been talking all week about how it's time to step up as a community and help each other out. And this morning, for the first time, I woke up and I'm on one of my kind of those neighborhood private groups, but you know they document where you live and then you can be part of that neighborhood group. And there were two different messages. One offering to buy groceries for anyone who it was not safe to go out to a grocery store, you know, the elderly, the immunocompromised, or people with particularly serious medical conditions. And another person was offering to help organize childcare for parents who had critical workforce jobs and really needed to go into work, but their children's schools had been closed. So this is what I knew would happen in this community. We have such an amazing community, and I think everyone can just take some very common sense precautions, but if a neighbor can watch, you know, 2 or 3 children and, you know, make sure some of the things we talked about before, no temperatures, no one else in the other home is sick, just some common sense precautions. We can help each other out through this. We will absolutely get through this, and this will have an end. So thank you all, and happy to take questions.
We've had a lot of questions and concerns that the county may have seen its first death due to COVID-19.
I have gotten no reports of any fatalities.
The King of Prussia Mall just decided to close, it seems. Was there any communication between you as a county to them?
There was no communication between us and the mall. No.
Dr. Arkush, do you know how many people are who have been forced to be quarantined?
I do not.
Who actually calls them to tell them they are to quarantine?
So the way the process of contact tracing works is once a person is identified as a presumptive positive, and just to review, that means their first test was positive wherever that was done in a certified lab, and then that sample goes on to the CDC and they confirm the positive, but obviously we don't want to wait for that, so as soon as we get a positive, we immediately take action. So as soon as someone is identified, we get their contact information, and a member of our Office of Public Health begins the contact tracing. So it starts with a phone call to that individual, and that individual is asked a series of questions about where they've been for some period of time, depending upon when they first developed symptoms. And we ask them to try to recall every person, every place that they went to. And then, once we get that list, we start working that list. So if it's a big business, they'll often get the first call, or if it's a school, that type of thing, and then we continue down all their contacts. And their contacts are told they have to quarantine. Any business or school where they were is told, now the schools are all closed, but previously they would close and do a deep clean. If it's a business, we tell them they have to close and do a deep clean before they can reopen.
And all week we've been talking about presumptive positive cases. Have you gotten any reports back from the CDC that they've been confirmed?
No, I don't believe any of our Montgomery County cases have. I did briefly hear Secretary Levine, the governor had a press conference just before ours, and I think that she said, and I'm not certain of this number, there had been some number, and it's in the single digits of cases from Pennsylvania that the CDC has confirmed. But that's it, it's a pretty small number.
And earlier you said the trails are open.
The trails are
Are
open.
the parks open?
Um,
Because there's a notice at Norristown
Right.
Farm Park that it's
It's
been
closed.
closed, and
Yeah.
I've gotten a lot of
I think,
emails from people about that.
so for reasons of congregation of the public, we are officially closing our parks because we don't want 50 people to show up for a picnic at one of our parks. So all permits have been revoked, and the parks should be considered closed. But if the trail goes through the park, you can ride your bike or run or walk through, but we do not want people congregating.
So the park, is it just for the 2 weeks, or is it until further
So
notice?
for now, it's 2 weeks, and we are gonna reevaluate sometime probably at the end of this first week and see where we are and see if we can anticipate anything at that point.
And how many parks are there in the county?
7.
In the historical sites.
Yes, and all of our historical sites are closed as well, so there's no historic tours or anything like that.
Of your cases, do you know how many are still hospitalized?
No, I don't. We get notification if they are hospitalized. We do not get notification if they are discharged. So I believe there are some that are still hospitalized, but I don't have those numbers. We do announce it though when I do my daily, here are the new cases. We let you know if they're hospitalized or at home.
What's your situation with test kits, and have you received any word on the federal level about when you'd be getting more of them?
So as I mentioned, the Office of Public Health doesn't actually conduct testing. So the testing that we've helped facilitate, which is very, very little, has been with some partners. We do not have any firm dates on when we might have more ability to do testing. Believe me, I will let you know as soon as we do.
You mentioned essential businesses, and Governor Tom Wolf kind of clarifying some of those things. Do you fall in line with kind of what he says about essential businesses and those that are not should close? There seems to be still some gray area amongst business owners in the county of are they essential, are they not? They believe they are. Sounds like the governor says they're not. Where do you stand on that?
Yeah, I really can't clarify the governor's statement other than what I shared with you. I would urge if any business wants the county's thoughts on whether or not they're essential, they should just feel free to reach out to us. I'll give one example. I was contacted by a company that's a cleaning company, wondering if they should close. And I said, no, we need people who know how to do deep cleaning for our businesses and things like that. So we would not want someone like that to close. The governor, to be clear, is only strongly recommending. He has not ordered the closure of any businesses that I'm aware of.
However, the county has a number of small businesses that I'm sure are very concerned that if this continues on, they won't be able to survive. I'm wondering, in conversations with them, what have you said to them if they feel that if I close, I might not ever reopen?
I don't know if anyone's actually said that. I have not had anyone say that to me. Our Commerce Director, David Zellers, is working very closely with our business community. We had one large, well-attended call yesterday or the day before, and I know there's more scheduled. So any business that has concerns like that should feel free to reach out to David Zellers in our Commerce Department. We do have loan programs and other things that might be able to help in this moment. I also, and I have not had a chance to actually read it, but I believe that about 1 a.m. this morning, Congress did pass some sort of emergency relief bill, and that contained within that, there is some help for businesses, small businesses, I think in particular, and also, I think people who don't have employer-offered sick time or paid sick time. But I don't have those details at the tip of my fingers.
Thank you.
Yeah, but they should reach out, anyone with concerns.
From last week when we got our first 2 confirmed cases to this week, have the calls continued to go up? Have they leveled off? Is there more concern, less concern in your eyes?
I would say concern peaked on Thursday when we started announcing that the schools were closing. You know, it's like anything. When something happens and it seems a relatively small scale for the public, they sort of pay attention, but then every day, as there's been more and more cases here in Montgomery County, we do remain the county with the most cases in the Commonwealth. That has really focused people's attention on the situation. And of course, obviously, the closing of schools and the governor's discussion of businesses has gotten a lot of people's attention. So I think most people are paying attention now, which is great, because we want them to pay attention. And what we want them to know is that 80% of the people who get this disease are going to be just fine. They're going to have very mild symptoms. What the school closures and some of these other mitigation strategies are about is reducing the total number of people who get this disease and the rate at which they get it. So this is our flatten the curve. That is a hashtag now, by the way. I hope you're all using it, flatten the curve. So what we're trying to avoid is this big yellow spike. If we get a spike like that, we will be like Italy, with hospitals that are overwhelmed, first responders that are overwhelmed. Our goal is to flatten that curve, be the purple curve. We know we have coronavirus in our community. We know the vast majority of people are going to be just fine. But for those that are elderly, immunocompromised, or have underlying medical conditions where they might become ill and require hospitalization, we want to do our absolute best to make sure that there's a place for them in our hospitals and that we have the first responders there to get them there. So that is what the goal of all of this is. So as I said many times this week, we have to put the needs of our community before our personal inconvenience or convenience, depending on the situation. This is one of those moments where if we pull together as a community, look out for our neighbors, look out for those that need some help, we are going to get through this, and there will be an end, and this is not going to be our forever normal. But we do need to take those steps now. All right, thank you, everybody. We will make an announcement about tomorrow, whether or not we're going to have a press conference. We don't have a final decision on that yet, so we will send an advisory out if we are going to have a press conference tomorrow. Thank you.